Your responsibilities. Your responsibilities include knowing all your medications, including dosage, times to take them, and why you are taking them. Ensure you adhere to your medication schedule. Maintain good contact with your transplant team via your transplant coordinator. You must attend appointments and have blood tests drawn routinely as instructed. Maintain a healthy lifestyle as we will outline. The liver transplant team is made up of the transplant surgeon who performs the transplant surgery and takes care of surgical issues. The liver transplant fellow is a fully trained surgeon that is completing additional training in liver transplants. The hepatologists are medical service physicians who specialize in caring for your liver-related diseases. Once you are discharged from the hospital and surgery clinic, the hepatologist will manage your care as an outpatient. The nurse practitioner is a registered nurse with advanced education and training. Nurse practitioners are responsible for the majority of your daily care after you have been transferred out of the ICU. The nurse practitioner also works alongside the hepatologist in the outpatient clinic. The transplant coordinator is an RN or nurse practitioner who has specialized training in caring for liver transplant patients. A transplant coordinator will be involved in preparing you for discharge and will be monitoring your care once you are discharged home. The social worker is available to assist you with a variety of needs. They provide emotional support to you and your family and help troubleshoot issues that will affect your ability to be discharged home. The case managers coordinate home discharge, ensuring prescribed medical equipment, home health, and any home needs are arranged. The dietitian will educate you on diet changes and food safety prior to discharge home. It is important to follow any dietary restrictions as you are instructed. The diabetic team will address any diabetic needs or concerns you may have on discharge. If you are going home on insulin, they will ensure you are educated on the management of your blood sugars and the giving of insulin. The pharmacist will go over your transplant medications with you prior to discharge. You will have a one-on-one training session with the pharmacist. The new medications are very important. The road to recovery pathway. The intensive care unit. After surgery, you will go to the liver transplant ICU. As you recover from your liver transplant, it is very important that we monitor you closely to prevent any complications. The ICU can be overwhelming. Here are some things to expect. You will have a breathing tube connected to a ventilator. The liver transplant team will take the breathing tube out as soon as you are able to breathe on your own. You will be connected to a monitor that continuously monitors your heart and blood pressure. You will have many IV lines, tubes, and drains. You may be connected to a continuous dialysis machine. There will be frequent blood draws and chest x-rays. IV medications will be adjusted frequently. The physical therapist and occupational therapist will start to evaluate what you need to safely get you home. There will be multidisciplinary rounding by the teams that are managing your care. Once you are stable, you will transfer out of the ICU to the floor on 8 North. Once you are on the transplant floor, you will continue to work with the physical and occupational therapist with walking and other physical exercises. You will learn to take care of your incision, drains, or IV lines that you may go home with. You will continue to have medication adjustments. There will be daily lab draws and chest x-rays as needed. Discharge education will continue. Even before you had your transplant, you should have identified your primary and backup caregivers who will be helping you at home 24/7 for at least the first month. Our goal is to discharge you home safely. If necessary, you may have to go to an acute rehab facility for continued medical care and aggressive physical therapy until you are strong and safe to go home. It is important to arrange your ride home for discharge by 11 a.m. The case manager will see you and your caregiver to talk about your needs at home prior to discharge. With the exception of Kaiser patients, discharge medications will come from the Ronald Reagan Discharge Pharmacy. Copays. Every patient has a different medication insurance plan. We do not know the details of your plan. You can call the pharmacy or your insurance to determine your copay. The copay cost is usually approximately $50 to $1,500 per month. Kaiser patients receive 3 months of medications at discharge. If you have Kaiser insurance, your pharmacy is the Kaiser Sunset Pharmacy, and most pharmacies have a mail delivery service. Medication education. A pharmacist will teach you and your caregiver about your medications before you leave the hospital. We will teach you again before you go home. Before you go home, we will meet with you and your caregivers in your hospital room to review all of your medications and follow-up appointments. A detailed medication list and all the medications will be handed to you and your caregiver at this time. Refills once you return home. Call the pharmacy, the number is on each bottle, to order your refills. You should contact your pharmacy at least 7 days before you run out of medications. If you just call a few days prior to running out of your medications, you can miss doses of some very important medications. Equipment and home nursing visits are coordinated based on the doctor's orders. The case manager will coordinate the medical equipment and the home nursing visits that you will require. Insurance only pays for a limited number of home nursing visits. Your insurance will not pay for 24/7 or hourly care. Not everything may be covered by your insurance. If medical equipment, such as a walker or commode, is recommended by your physician, it should be covered by your insurance. If it is covered, it will be delivered to your hospital room or to your home prior to discharge. If recommended equipment is not covered by your insurance, you may rent or purchase these items at most pharmacies such as Walgreens, CVS, or Rite Aid. Your case manager will help you with this. On the morning of discharge from the hospital, the transplant team will review your case to ensure you are stable for discharge. The transplant coordinator will review when you need to have labs drawn and the date for the first follow-up appointment with the transplant surgeon. The pharmacist will come to your bedside with the finalized medication list and all of your discharge medications. The bedside nurse will review the after-visit summary with your written discharge instructions. Discharge time is 11 a.m. If you live too far away to drive to clinic every week or have to come from another state, you must stay in the local area near UCLA for the first 4 weeks after your discharge. You may want to make arrangements to stay at the UCLA Tiverton House or in a hotel near UCLA. Contact your insurance to see if they will pay for any part of your room and board following the transplant. Your transplant physician will let you know when it is safe for you to return home. If you come from another country, we recommend that you remain in Southern California for at least 4 to 6 months.